we are with our radius, and of course, as we always start off with, we're trying to figure out laterality, so you can get that right. I mean, right and left do matter. People amputate the wrong ones. So let's take a look at this radius. This is the radius. We can actually see it's very characteristic with this nail-like head here. And so again, we're going to try to figure out laterality with using our markings. So the first and foremost is our head. It's followed up by a little nice neck, and literally it's called the head of the radius, the neck of the radius, and that's always proximal. So if that's going to be proximal, then we got to figure out then what's medial and lateral. As I travel along the radius, you'll find that always keeping in mind that radius is on the lateral side of our body, towards the thumb, lateral side, towards the thumb, radius is. You'll find that it has this little sharp edge. The sharp edge is something what we call the styloid process. And you're like, styloid? I heard of that before. Right, there's 3 other bones, or actually 5 other bones. The left radius, and then the 2 ulnas, and then 2 temporal bones that have a styloid process. It comes from the root term stylus, and if you know anything about stylus, there are places where you would want to write. And so if you had a choice, you would write on this little tip called the styloid process of the radius. And then you have to qualify that because you have other styloid process. And so that's always going to be lateral, towards the thumb. You could actually feel it here on this little bit of your wrist. So this is the styloid process. So far we've got a head, neck, and then we got this tip. Styloid process, that is lateral. So that means this little notch here is going to be, you can hopefully see this little notch, that's where it's going to articulate with the ulna, making our distal radial ulnar joint. And this ulnar notch is always medial. So if you forget, oh, which one's lateral and medial? Well, ulna is always medial, one or the other. You got to remember the radius is on the lateral side or the ulna is on the medial side. And so this little guy, ulnar notch, is going to be on the medial side, and so now I know it's going to be on my thumb side, so that's going to be here. Now the question is, it could go either way now. I'm still qualified to say that that's on my thumb side, so we got to figure out what's anterior, posterior. And one of the ways you'd be able to do that is you can see this big gigantic knot. And this knot is called the radial tuberosity. Tuberosity, it sounds really thick and rough and big. And that's what it is. This is big, rough, and tuberosity marking called the radial tuberosity that attaches our biceps brachii muscle. Now I have to say this in relative terms, it is more anterior. Part of the reason why is because if I were to flip this over, you can still kind of see it peeking out. But the prominent portion is if I were to turn it and keep it anteriorly, you can see it still bends a little bit medially, but most of it is shown here. So this is my left radius, in order to keep the radial styloid process of the radius lateral and keeping the head proximal and then the radial tuberosity anterior, I have to keep it on my left hand. And so, quick review, head, neck, radial tuberosity, and then styloid process, and then ulnar notch.